Hello everyone, welcome to my medical coding tutorial series. In this playlist, we are diving into the CPT guidelines for the integumentary system. I have divided this tutorial into easily understandable parts. For each section, I will go through CPT guidelines with relevant examples. Also, each section will contain MCQs, that is, mimicking the real AAPC CPC exam questions. With the theory and the practice questions, you will easily understand the CPT coding guidelines and how to handle the CPT coding question. Integumentary System Part 2, Biopsy, removal of skin tags and shaving. Biopsy. There are important guidelines in the CPT codebook. You have to highlight them. So I have highlighted here. The use of biopsy procedure codes indicate that procedure to obtain tissue solely for diagnostic histopathologic examination was performed independently or was unrelated to or distinct from other procedures or services provided at a time. For example, so during certain surgical procedures in the integumentary system, such as excision, destruction, or shave removals, the removed tissue is often submitted for pathologic examination. The obtaining of tissue for pathology during the course of these procedures is a routine component of such procedures. This obtaining of tissue is not considered a separate biopsy procedure and is not separately reported. So you have to be careful here. This is not considered as a separate biopsy procedure and is not separately reported. Partial thickness biopsies are those that sample a portion of thickness of skin or mucous membrane and do not penetrate below the dermis or lamina propria. Full thickness biopsies penetrate into the tissue deep to the dermis or lamina propria into the subcutaneous or submucosal space. Sampling of stratum corneum only by any modality, example skin scraping, tape scraping, does not constitute a skin biopsy procedure and is not separately reportable. That's also very important. When you take skin biopsies, there are three types. So the skin biopsy codes are 11,102 to 11,107. The first type is tangential biopsy, example shave, scoop, source rice, or curate. So you can see here, remove a sample of an epidermal tissue with or without the portion of underlying dermis. The intent of the tangential biopsy is to obtain a tissue sample from a lesion for the purpose of diagnostic pathologic examination. Biopsy of lesions by tangential technique is not considered as an excision. Next one is punch biopsy. You can see here, requires a punch tool to remove a full thickness cylindrical sample of a skin. You can see the sample here. The simple closure of the defect is included in the service. You don't have to code the simple closure separately. So manipulation of the biopsy defect to improve wound approximation is included in simple closure. The next one is incisional biopsy. You can see here, the requires the use of sharp blade, not a punch tool, to remove a full thickness sample of tissue via a vertical incision or wedge penetrating deep to the dermis into the subcutaneous space. You can see the sample here. Also, closure is usually performed on incisional biopsies. Simple closure is not separately reported. So when you take the codes, you can see its codes start from 11,102 to 107. You can see the description. Tangential biopsy, single lesion, then additional lesion. Similarly, punch biopsy, single lesion and additional lesion. Then incisional biopsy, single lesion and each additional lesion. The codes are going on like. So let's see some examples. Question number 9. This is the continuation of previous parts. What is included in the CPT description for code 11,104 and 11,106? That is punch and incisional biopsies, and is not separately reportable. A. Local or regional anesthesia. B. Tissue examination. C. Simple closure when performed. D. Specimen handling. Think the answer. The correct answer is C. Simple closure when performed. When you see the description of each course, you can see within bracket including simple closure when performed. Both courses are describing like that. So you no need to separately code the simple closure. Question number 10. A dermatologist performs a punch biopsy on a lesion on a patient's scalp and a separate punch biopsy on a lesion on a patient's leg during the same visit. What is the correct coding for these two procedures? So there are 4 answers available. Take your CPT codebook and find the answer. So here you have to highlight this is a punch biopsy, the lesion on a patient's scalp and a lesion on a patient's leg. So you can use the elimination method in the exam, but for the learning purpose, you can use the contents method or the index method. If you use tabs for the CPT, so you can directly go to the integumentary system table of contents. There you can directly see the subsection skin and subcutaneous. their biopsy. The code range is here, so you can directly go to the code range. If you're using the CPT alphabetic index, you have to go first. You have to go to the index of biopsy, then go to the subcategory of skin lesion, then go to the subcategory of punch. It will lead you to the following two codes. So let's see the code. So when you go to the tabular list, you can see 11,104 is punch biopsy of skin single lesion. 11,105 is each separate additional lesion. So here you can see there are two biopsies, punch biopsies. So first one you have to use this code. Second one you can use this add-on code. So for using add-on code, no need to use the modifier. So the correct answer is answer B. Question number 11. A patient presents for an evaluation of suspicious skin lesions. The physician performs a punch biopsy on the lesion on the forearm and two tangential biopsies on the lesion on the chest. What is the correct CPT code combination to report these procedures? So there are four answers available. Take your CPT code book and find the answer. So here you have to highlight this is punch biopsy on the lesion of the forearm and two tangential biopsies on the lesions on the chest. So again use the table of contents or the alphabetic index method to go to the code series. Once you go there, you can see the punch biopsy of the skin single lesion is 11,104. So here you can see the punch biopsy only one. So 11,004 is used, but the tangential biopsies there are two codes. So when you see the tangential biopsy, 11,002 for the single lesion, 11,003 for the additional lesions. So in this case, you may think 104 and 102 and 103 may be the answer, but that is wrong because in this skin biopsy, only one primary code, that is 102, 104 and 106 is reported per patient encounter. So punch biopsy is typically considered the primary procedure, depend on the highest RVU or intensity after incisional, and is reported with 11,104. Then the additional tangential biopsies, both remaining procedures are tangential biopsies regardless of the techniques, are reported with their technique specified add-on codes. So for tangential biopsy, you are using 102, but you have to use the add-on code only. So the first tangential biopsy is reported as 103, and the second tangential biopsy is used by multiplication. So the correct answer will be answer C. So this is the example provided in your CPT codebook. When you see the CPT codebook example, you can see here one punch biopsy and two tangential biopsy. The coding is like that: 11,104 and 11,103 into 2. So you can check your CPT codebook as well. Next topic is removal of skin tags, which means removal of benign small fleshy growths. The codes based on the number of skin tags removed using any methods. Example: scissoring, electrocautery or ligation. So they are considered as cosmetic unless medically necessary. There are two codes. 11,200 is for removal of up to 15 skin tags, 201 for each additional 10 skin tags. Let's see an example. A physician documents the removal of 25 separate skin tags from a patient's axilla and chest. What is the correct CPT code sequence to report this service? So there are four answers available. Take your CPT code book and find the answer. So here you have to highlight this is 25 separate skin tags removal. So if you are using CPT alphabetic index, first you have to search for the term removal, then go to the subterm skin tags. It will lead you to the codes 11,200 and 201. So when you read the description of 11,200 is removal of skin tags, multiple fibrocutaneous tags any area up to and including 15 lesions. 201 is each additional 10 lesions. So in our case it is 25. So the first 15 you have to use 11,200 and additional 10 you have to use the other code 11,201. So the correct answer will be answer A. Next topic is shaving of epidermal or dermal lesions. So you can see here, horizontal slicing of a raised lesion without taking a full thickness excision is called the shaving. This includes local anesthesia, chemical or electrocauterization of the wound. The wound does not require suture closure. So the code series include 11,300 to 11,313. They are divided by the anatomic site. For example, trunk, arms and leg include these three codes. Scalp, neck, hands, feet are using these codes. Face, ear, mucous membrane using these code series. And size-based coding. So these code ranges are changed depending on the size of the lesion. For example, 11,300 is shaving less than 0.5 centimeter. Next code is 0.6 to 1 centimeter. Next code is 1.1 into 2 centimeter. 11,303 is more than 2 centimeter. Likewise, each code series will differ. So let's see couple of examples to understand this. Question number 13. A physician performs a shave removal of a seborrheic keratitis measuring 1.5 centimeter in diameter located in the patient's back. What is the correct CPT code? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is shave removal of a seborrheic keratitis measuring 1.5 centimeter on the back. So if you are using the table of contents method, you can go to the integumentary section. There you can see the contents of table of contents of shaving of epidermal or dermal lesion. You can see this code series. You can go to the table list and confirm the answer. If you are using the alphabetic index, you have to search with the term shaving, then go to the subcurve skin lesion. It will lead you to the same code series list. Here you can see on the back. So back is the trunk. So 11,300 is shaving of epidermal or dermal lesion, single lesion, trunk, arm or leg. So 0.5 centimeter or less you can use 11,300. But in our case it is 1.5 centimeter. So 1.5 centimeter it is included within this range, 1.1 to 2 centimeter. So the correct code will be 11,302. The next question, the physician saves an epidermal nevus with the diameter of 2.5 centimeter from the patient's scalp. What CPT code is reported? So there are 4 answers available. Take your CPT code book and find the answer. So here you have to highlight this is shaving on epidermal nevus 2.5 centimeter on the scalp. Again, if you are using the alphabetic index, go to shaving, then skin lesion, this code range. So once you go to the code range, you can see 11,305 is shaving of epidermal or dermal lesion, single lesion scalp. So this is scalp included. Lesion diameter 0.5 centimeter or less. In our case, it is 2.5 centimeter. So 11,308 is lesion diameter over 2 centimeter. So in our case, the lesion is 2.5 centimeter. So the correct code will be 11,308. So this is the end of this part. If you have any issues, feel free to leave in the comment section, or else you can contact me using WhatsApp and email addresses. Please subscribe my channel and keep in touch. Thank you.